All right, let's talk about breast implants and try to give you guys some education on it. We're going to talk about sizes first. You can see as I pan out, there's many different sizes. I'm going to go to the smallest one first. This is about the smallest as we'll use, and it's a 195 cc implant, 195 cc's. Remember, for every 200 cc's of volume, that's going to be an increase more or less of 1 cup size. So if you want about a 1 cup size increase, you'd go with 200. If you want 1.5 cup size, you'd go with 300. 2 cup sizes, 400. And as we go up, and so 200, and it goes all the way up to a 700 cc implant. This, I would rarely use this. There's many, as we often talk about, many challenges with very large implants and placing large implants into people, into our patients. They can have a lot of just discomfort and pain, and they're fairly heavy. In general, in our practice at New Life Cosmetics, we will generally go anywhere from 250, probably on the smaller end. So this is a 200, but more like a 250. So between here and here, all the way up to around a 550. This is a 500. So between the 500 and 600, we'll rarely do 600s, rarely do 700s. Like I said, just because of the issues that it can have when you have really large implants over time, especially they can cause a lot of discomfort and so on. So in general, we're right in this area. Okay. Next thing I'm going to talk to you about is the different profiles. Okay, with profiles, I have 3 profiles here. These are the most common ones we use, and there are some on the lower end, but mainly the way we use is a moderate plus profile, a high profile, and a ultra high profile. So what does that mean? The moderate plus profile is going to be wider, but not as high as the high profile. So if you compare the two, you can see moderate plus is wider than the high profile, but the high profile goes up more, okay? So when do I use a moderate plus? I use a moderate plus in a lady who has more natural kind of sagging breast tissue that's not getting a lift. And the reason I do that is because when it's placed underneath the muscle, you're gonna have more roundness and fullness on the lower portion versus the upper portion of the breast. And so the nipple is going to be down farther down lower in a person with some aging. And so you're going to see here how there is more volume on the lower pole versus the upper pole or the top portion of the implant. With a high profile, you can see that there's more volume in the mid to upper portion. And then as you get to an ultra high profile, it even has more volume on top. So I'd really only use an ultra profile on a woman that has a narrow chest and does not have any sagging of the breast tissue whatsoever. And that would give them good upper pole fullness. And it's also a narrower implant that then would fit into their chest wall nicely. Now we're going to talk about the consistency of the gel implant. The gel implant has a typical traditional gel implant. These were not the gummy bears. People get that mixed up. They think the gummy bear implants are all gel implants. That's generally not what we term gummy bear implants. Gummy bear implants are going to be what we call your extra fill implants or your high cohesiveness implants. And so you can see the difference between these two implants. One's a 350. This is a 355. Yeah, 350. 5 cc is really no difference at all. It's 1 teaspoon. But you can see how this one maintains its structure more. Now this is going to be a little bit firmer. By touch, a little bit firmer. This is a little bit more squishy. In general, we're using these gummy bear implants on almost all of our patients because I like just the structure that it maintains, as well as still feels very natural. These implants, though, still, the non-gummy bear implants are still a very popular implant. Remember, it's not gonna ripple like this because when it's placed underneath the muscle and skin and it's in a pocket, it's going to be pushed down like that. So you won't see that rippling effect like you see with the saline implants. But you can see how this one maintains a little bit better structure overall versus the non-gummy bear implant. But if you really want more of a soft feel to your breast and more kind of a squishy feeling versus a little bit firmer, then you're going to want to go with the non-gummy bear implant. Now, Mentor has even a higher cohesiveness implant called the Boost implant, and that is different than the gummy bear implant or the extra fill implant. These are, different sizes. This is a 485 and a 355, but you could see compared to even the extra fill implant, this one is even rounder up top, is fairly firm. It's going to really give you defined cleavage lines. Starting to use some more boost. They're still soft, but definitely not as soft as the extra fill gummy bears. So if you're looking to go for more of a really well-defined look, still being somewhat soft, but really want that upper pole fullness, you're going to probably want to go with the high-profile Boost implant that are now available. Now, the next thing to discuss is actually there's two different types of consistency of implants. Everyone probably knows this, but there's the gel implant that we've been discussing. There's also a saline implant. The saline implant, I don't really use much for multiple reasons, which I'll tell you right now. But the saline implant comes, what we do is we just take an implant shell like this, place it underneath the muscle, and then fill it up with water. This one's just filled up with air right now, but you fill it up with water, and so you're able to make a smaller incision because you're able to roll it up into a small little, almost like a little taco, and you push it in. So benefits of a saline is, one, it gives you a smaller incision. Two, they do cost a little bit less, but I don't think the cost is worth the downsides to it. And three, if you were to have a rupture, you would know immediately. Ruptures are very, very rare, but if the shell were to rupture, the implant would just leak out the fluid and you'd know immediately. If you're to have a rupture or a shell opening with the gummy bear type implants, or the gel implants, you're not going to know it immediately. You might start having a little bit of pain, and you'd have to have an evaluation with an MRI study to see whether or not it's ruptured or not. Where the saline implants, you would know immediately. Obviously, the water would leak out and your breast would deflate. Main reasons why I prefer not to use the saline implants is they develop something called rippling, and rippling is where you feel the edges underneath your breast tissue. And so especially if a person does not have a lot of breast tissue and you place a saline implant underneath their breast tissue, very high chance of feeling this rippling, and it's annoying, and you can feel right underneath the skin, where you really don't feel that with the gel implants. So the rippling, number one, wouldn't use saline implants. The second thing is just consistency and feel. In general, you're going to feel with the gel implants a lot more just kind of squishiness and natural feel. In order to prevent the rippling with the saline implants, you have to overfill them. So you have to fill them up like a water balloon and overfill them, so you can do everything to avoid feeling the rippling. And when you do that, it's really more of a firm feel, and they're not as squishy and not as natural in feeling. The last thing let's talk about is just the shell around the implant and the consistency of it. So gel implants, predominantly what's used is pretty much worldwide is the smooth implants, meaning the shell is very smooth. It doesn't have the rough texture like these textured ones. But why textured ones were used in the past was because they decreased the risk of what we call capsular contracture. Although not extremely common, it can happen. And people that had the textured implants had less risk of capsular contracture. It's an inflammation around the breast capsule. Why don't we use them? Well, there was reports that these implants were associated with a very rare case of lymphoma of the breast. And so they basically have not been used at all in the United States. There might be some doctors, surgeons that are using them for specific cases, but in generally, we never use textured implants any longer because of that association with that rare form of breast cancer. All right, hopefully that was helpful understanding breast implants. If you have any questions, please let us know. It's all discussed also in your consultation, where we go over the risks, benefits, indications, and alternatives with having a breast augmentation, and go over the different types of implants with you to make sure that you get a customized approach to what's the best implant for you. But let us know. Hopefully this was helpful.